So which specialty is the perfect combination of medicine and dentistry? Also, what's the type of oral surgery program where you can receive the circle of knowledge? We got answers to your questions, and we're going to be spotlighting a top oral surgery program and give you all the details about ideal candidate, typical day, mission, all the things you need to know before you apply. Stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, surviving residency, and then life as a new dentist. Guys, be sure, if you are liking this content that you're seeing here on this channel, please share, like it, share, and give us comments. Give me comments as to other types of stories and things that you want to hear. All right. This channel is for you. All right. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. That's right. GetIntoDentalResidency.com with super tips, strategies, and help designed to help you get into residency, not now, but right now, this application cycle. So for more details, go over to the website, GetIntoDentalResidency.com for more details. So today we are joined with a leading educator in dentistry and also into the what we call the circle of knowledge of dentistry, and one of the most challenging and also competitive specialties, oral surgery. We're here with Dr. Calhoun, who's going to share a little bit more about the program, the oral surgery program at Harbor-UCLA on the West Coast. So I know many of you are looking to have a deeper dive into residency programs beyond what's just on the website. So stay tuned all the way through the end. Take notes. Be sure to go back, listen, and that's what this episode is here for. So, Dr. Calhoun, how are you doing?
I am excellent.
Good. I know it's a little early for you out there on the West Coast, so we appreciate you hanging in there and coming out to talk and share a little bit more about your program. So before we get started completely, we want to give you an opportunity to share a little bit about yourself for those of you that are meeting you for the first time. They might have met you, if they've been watching these videos, they might have met you a couple of years ago where we were talking about oral surgery as a specialty, but we're going to be doing a deeper dive. So please introduce yourself.
Okay, so I am Calonya Calhoun, Dr. Calhoun, and I chose oral surgery at pretty early in my career as a junior in college, and because I worked at a hospital and was exposed to oral surgery. I ended up attending University of Michigan Dental School of Dentistry. And then after that, I completed my oral surgery residency at Martin Luther King Hospital, which is now known as Harbor-UCLA Medical Center. And in addition to that, I decided to also pursue my PhD because I felt like it would make me a more competitive candidate in academia, which was always my heart, to teach others what I love to do. And shortly thereafter, I became faculty after I finished my PhD at Harbor-UCLA. And I was junior faculty for about 7 years, kind of functionally as an assistant program director for about half of that time, and then became program director in 2014. And 2 years later became division chief, and then just recently recruited another surgeon that graduated from our program, a phenomenal surgeon, to fill my position as the program director for our residency training program.
Gotcha. So tell us a little bit about why oral surgery. Like, why did you pick oral surgery out of all the specialties? And then also, what do you like best about the specialty as well?
Okay, that's a great question. I know that there is always this thought that all people choose oral surgery because they want to be a plastic surgeon or ENT, but they had difficulties in getting a medical school or what have you. But for me, I always loved dentistry. I loved teeth. I wanted to be a dentist since I was in fourth grade. So I was committed to that until I started working in the hospital, because I loved that environment, that fast-paced environment where you get called because a patient's airway is compromised. And I wanted to be that person. And so I was trying to figure out what could I do in medicine that would still give me what I love about what we do as a dentist. And I ran into an oral surgery resident who actually saw me studying dental anatomy as a junior in college. Rented out got a book from the library, and he told me about oral surgery. And then he invited me to watch one of the surgeries that he was doing with his attending, and it was orthodontic surgery. And I was hooked. I memorized the whole surgical procedure from start to finish, not intentionally, just I was so into it. And so that I wasn't disappointed after I got into residency, because it gave me exactly what I wanted. I did emergency intubations. And I mean, it was just that kind of feeling where you are doing something that no one else can do in your in other specialties, even in medical specialties, with our expertise in anesthesia and all that stuff. So now, what do I like most about oral surgery? I kind of already alluded to it. I love anesthesia, because that is like the perfect mesh between dentistry and medicine. And we are the rulers of the airway. When I did my anesthesia rotation, the attending that I was assigned to told me, he says, I will, as soon as we became an independent, he says, Dr. Calhoun, I know oral surgeons are good in the airway, so you can do a nasal intubation. And I'm thinking to myself, but I've never intubated. I found that he knew what he was talking about, that our skills dealing with millimeters and detail were easily translated into actually every rotation, but in particular anesthesia. And so that's probably one of my favorite areas of oral surgery. But my other two loves are anything that leads to us having to put together a puzzle that's been broken. So trauma and pathology and reconstruction are also things that those are my niches, besides regenerative medicine as far as on the research side.
Gotcha. All right, great overview. So you guys are thinking about oral surgery and have some commonality on why oral surgery, or why you think you want to do oral surgery. There's a comparison. See if your why is lining up with one of the leaders in oral surgery as well. So let's lead into the spotlight part, right? So things that we're going to be talking about the overview of a program. We're going to talk about the mission and purpose, the curriculum and the structure, the patient caseload, number of residents, what the program is known for, and then also the strengths and areas where the program is continuing to seek improvement. And then we'll continue on with the ideal candidate and some tips. So guys, make sure you're listening all the way through. Don't skip. Listen all the way through. All right, so let's go into the deeper dive now. Mission, purpose. Let's talk a little bit about that as it relates to Harbor-UCLA.
So in general, being a safety net hospital in South Los Angeles area, the focus has always been to provide care for our patients at the same level that you would want to care for your family members. And so that doesn't mean that we give you the leftovers, but that we offer everything that is necessary that we would want our own family members to experience. And so we've translated that into our division as a whole, where we have every specialty available so that we can work together with our orthodontist. We can work together with our GPR. We can work together with our maxillofacial prosthodontist to give high quality, low cost care for our patients. And it gives you an opportunity to give back, but it also gives you opportunity to work with state of the art equipment, specifically at our hospital. I mean, we have 3D printing of our prosthesis. And our maxillofacial prosthodontist works with us in placing implants and fibulas at the time of the operation so that the patient leaves with teeth after having a resection. And so we're really trying to be on the leading and cutting edge in regards to that.
Let's talk a little bit about the curriculum and how the program is structured. I know, there are 4-year and there are also 6-year oral surgery programs, so we can talk a little bit about that, but also how the curriculum is divided up as it relates to both didactic and clinical, any types of rotations that residents go through as well.
Okay, so our program is one of the things that we have been known for is always advancing and increasing our scope of practice by bringing in volunteer faculty and such. And so because of that, we have some unique opportunities. So just to give you an overview, our program is 4 years. However, we've always been open to people wanting to pursue additional training. I obtained my PhD while I was in residency. One of my junior residents obtained his MPH during that time. So we've always been flexible in customizing the program so that you can get the most out of your experience. One of the things, so for our didactic, we have a very strong didactic program. Our residents do very well on the boards, as well as the in-service exams prior to taking the boards. And that, I think, is really evident because of our didactic component. So we have 1/2 day during the week that we spend on didactics, whether it's anesthesia, anatomy and surgical anatomy specifically, pharmacology, obviously, because of the anesthesia, a strong anesthesia background is required, and then case presentation, pre-op and post-op, and using 3D imaging and all those advanced technologies to ensure that we get great surgical outcomes with the surgical planning with different plating companies and such. And then we also have Friday mornings where we either have a journal club, we have a sim lab, anesthesia sim lab. We have this phenomenal a CRNA that also has a PhD in education, and she specifically caters to oral surgeons because she had a great experience being sedated for her wisdom teeth. And so she's a strong proponent for that. So she trains our residents very well in simulations that are customized for the oral surgeon. Let's see what else. Okay. And then we also have like a month plus or minus a month in research. And we have several research projects that are going where we're harvesting mucosa from the buccal area and using that as a scaffold for corneal transplants. So we have a PhD person that works with us. She's actually the director of dental research in our division. We also have some other projects with regenerative medicine, and we let the residents choose their own projects as well so that they can have complete buy-in. So I know that they had started using, I think it's PRF for wounds. One of our residents doing that. That resident is interested in cosmetics. We have a cosmetics trained fellow that comes in and does cosmetic cases with our residents, maybe once a month or so. And then we also have another part-time faculty that does a lot of cleft and craniofacial. And so he does cleft cases with our residents as well as rhinoplasties because he is also a cosmetics permit holder. Our residents also in their second and third year rotate to Kaiser Permanente, which is a tertiary care facility, and they are one of the major referral centers for orthognathics. So our residents do about 300 cases at Kaiser at minimum because they do 2 cases 3 times a week with 4 different attendings at Kaiser. They also do a lot of TMJ, actually quite a bit of TMJ, because one of our other volunteer faculty members is the premier TMJ surgeon out on the West Coast, Julian Wilson, and he has also a fellowship that many of our residents go to as well. let's see, we also, I know I'm going into cases just because it kind of overviews our curriculum. We also have an outpatient center at Martin Luther King where we do our GAs, and our residents get a phenomenal experience with GAs. We do about 750 GAs per year, and the minimum for our residents is 150 GAs per resident per year. And so we get a lot of experience in doing that. We also have a implant conference on early Wednesday mornings prior to our OR cases, where we interactions with our maxillofacial prosthodontists, our periodontists, as well as our surgeons and our restoring dentists. And our residents do at least 80 implants per resident per year, including all on fours and zygomatic implants. And then we also have an outpatient surgery center, which is associated with our outpatient clinics. And in that setting where we go to a mini OR, we do a lot of cosmetic cases and complex implant cases, as well as some TMJ biopsies and such. So I think we have a really robust program, and we have grown so much in the past 4 years. We call ourselves the biggest small program in the country.
Yeah, you guys are doing nonstop.
Yes.
Nonstop. I'm surprised. That means the residents, do they even sleep?
They actually do. They actually do. They sleep more than I was when I was a resident, I think. But they have ample opportunities, and we give them a lot of support. We also have a non-CAT intern that takes on a lot of the things that they get a benefit from, but that our residents also can then have time to do, because that's one of the reasons that we brought the non-CAT intern in, so that our residents could have opportunity to do some research. And they all do, because there's research is required, or some scholarly activity. And we push our residents to present at meetings, which they have, whether they're local or national meetings. And so, but we do give them a lot of support in ensuring that they can be successful in all of those areas.
Now, you mentioned non-category. For those that are listening that may not know it, this is a good segue to talking about the number of residents. So can you explain the non-category term, and then also touch on the number of residents, and if you all have what we call like an intern, because there's interns at some programs as well. So
the non-CAT intern is the intern that is not that did not match into the residency program. We take 2 residents a year. So we have 8 residents total. And then our non-categorical intern, or what some call a preliminary intern or just a 1-year intern, is that intern that gets an opportunity to learn everything that all the other residents are learning, including the clinical experiences. But they also, this gives them opportunity to shore up their application, and as well as ensure that this is the specialty that they would choose. And even though we do have a lot of busy time during the day, our call is moderate just because of the way managed care is. On our tooth call days, we don't always get a lot of calls because the GPRs usually support that by taking the tooth call. So we take call every 3rd night with plastics and ENT, or what they call face call. And we're relatively busy. We're not to the point where we never sleep, but you definitely get a full experience. And one of the things, there's a lot of things we're known for, because these are things that I've wanted to do. And I was just so happy to have this as my baby when I became program director, is that you graduate from this program not needing any fellowship training. You can choose it, but in the bread and butter oral surgery, you will get enough TMJ, you will get enough orthognathics, you will get enough anesthesia and exodontia and implants. And so we don't want you to have to go to any fellowship other than if you want to choose to do microvascular or cosmetics. And I think with our 2 faculty with cosmetics, you really do, if you have an interest, you get enough experience to be comfortable and even have enough cases if you need a permit for your particular state. A lot.
Wow. It's just a lot. You guys are listening and watching. I hope you took some notes fast, but even if you don't, you guys can go back and listen. Okay. But a lot of content there. that's probably a little bit deeper than you would find on the website
Yeah.
and other means of trying to find out more about the program. Um, so the program sounds like the program is known for the extensive level of experiences that are very broad but very deep
Yeah.
in those experiences. You talked about the implants, number of implants, a number of GA cases, number of orthognathic cases, and that could be a challenge for many programs, right? That's those numbers and those ways of getting those experiences for residents are key, and those are key milestones for that coda, for the standard. Make sure you guys are meeting the standards and making sure that residents are adequately trained in those areas. So, and if you guys listening, if you have other questions that maybe we didn't cover related to the program structure and the curriculum, put those comments down below, put those questions down below, and we will answer them. Let's also talk a little bit about the strengths. Well, strengths of the program again, pretty much what you guys are known for, which is the extensive experiences. What other strengths of the program are there within the program? And then also, could you touch a little bit about you know the assessment that is done on an annual basis and what that assessment is pointing towards related to areas for improvement, or whether it be expansion in the curriculum, whether it is tightening up some other aspects as well.
Okay. So I'll answer the second question first, and then I'll probably have to ask you to tell me the answer to the first question again. So what we do to, well, okay, the strengths, I can answer that. So the strengths, in addition to the surgical experience, when we survey our residents every 5 years for our in preparation for our site visit, every time the residents say faculty commitment as number one. And I think that's key because our legacy, we are so in tune with the fact that our residents are our legacy. So we don't lose touch with them after they finish. Most of them want to come back as volunteer if they're local. Some of them, actually, we have one that was accepted to a fellowship at Mass General for TMJ, endoscopic TMJ, and she really wants to come back, even though I'm encouraging her to consider all her opportunities. And I think you come well prepared, but the faculty support, I think, leads them to have a great experience, even in the midst of a busy residency. We're tough, but they know we care. Some of the other strengths, as I already mentioned, is that we have a commitment to ensure that you get the full scope. One of the things that we were trying to recruit in the beginning of of my tenure was a microvascular surgeon. We did not end up getting that microvascular surgeon, but plastics has recruited one that loves dentistry. He's in our dental clinic and our dental lab, sometimes more than the residents. And because of that, we have grown in our relationship with him and getting phenomenal opportunities because he's excited to work with dentistry and he understands the value of dentistry. Now, some of our areas that we need to improve, in general, our goal is that when you finish, that you will pass your boards immediately after. And that has been one of those things that I had to change my mindset when I was a resident, because I was probably a knucklehead when it came to thinking about the boards as being important, until I became a faculty member. And I was like, wow, when you look at 4-year programs and 6-year programs, the board is the great equalizer. Now, we have significantly improved in our in that area, because that's one of our outcome measures, is that, are you getting enough experience and didactic training to do well on those boards on your first try? And if you're not, then we are restructuring the program to ensure that that's the case. And some of those clues are also in our sites. So one of the biggest changes I made in our residency program was getting earlier experiences in the operating room, because our residents were not doing as well on trauma as they did when I was a resident, because we had so much trauma. We were in the operating room all the time. And the junior residents were in the operating room quite a bit, because we did a lot of cases at night when managed care wasn't as, a big of a thing, in, where, patients can be done on an outpatient basis more often. And so I restructured that so that the residents were going on their trauma rotations at a certain time, and then they were becoming what we had two levels of chiefdom. So you have the junior resident or the third-year resident that is trauma chief or clinic chief, and they did all the trauma unless it was something that the chief had not done. And as a result, they got a lot of early experiences. They operate on at least 20 plus mandibles before they get into their fourth year, and they do quite a fair amount of mid-face trauma as well. And so those are the kind of things, adjustments that we made to our program based on the OMSITE scores and based on the board certification stats. And as a result, our residents' OMSITEs for trauma have been phenomenal. In addition, most of our residents are close to outstanding in their outcome assessments for OMSITEs. In the past, everybody was satisfactory, with at least two people that were below satisfactory but not failing. And so now majority of our residents, if not all, are not just satisfactory, but outstanding in their OMSITEs. And I think that is something that we still need to, work on and improve, so that both first years, because they're usually the ones that struggle, both first years get that opportunity to at least be outstanding consistently.
Gotcha. Awesome. All right. Good overview of the program and some of the strengths and some areas that have been identified that you guys are already, seems like you guys are already, implementing those changes and those improvements, which is key. Also, let's talk a little bit about candidates, residents. And this is also part of the interview and the episode people love to know about, right? How do I, what is the ideal candidate at UCLA, Harbor-UCLA?
Yes. Okay. So this is always a difficult question for me to answer because we look at the whole package. Now, we've always been grit versus grades. We always felt like that grit was more important than grades. And that's because if you have the desire to do this and you are committed to doing it, you can do excellent. And I've seen that not just at our programs, but some of the other programs that we have close relationships with, that residents might have struggled while they're in dental school, but because they want oral surgery so much, they end up being the top performers on their OMSITE scores and phenomenal residents. So I'm convinced that your grit can help you overcome any weakness in your grades. With that being said, we are taking advantage of a lot of the tools that are required for you to do well on your CBCE. So with higher scores and great candidates that are well-rounded in every other area, you do have to perform well on your CBCE. You don't have to have what's the highest number that's out there, because we don't look and say, okay, we're only going to interview people that have the top score. We look at the whole candidate. In addition, and for me, I think being authentic is really important, because you can hit all the boxes. Oh, I do mission work, I do this, but you have to really have a commitment to wanting to serve the underserved. And so you have to search your heart if that's not what you thought is a priority, because you don't want to be in a program where you value numbers over the types of patients, or that you don't enjoy the challenge of that patient that has a lot of dental fear of doctors, because these are patients that don't get the care that's been needed. We have immigrants that come over and they don't speak English. And if you don't have a commitment to wanting to learn how to treat them well as clinically, then this will not be the program for you. And you won't be successful or happy during that time. So if that's something that is not your heart, but you really want to be at our program, then you have to search your soul to see how you can have that fit into your paradigm. And, because I believe anybody has a capacity to have that compassion so that they can, function, do well in our program. Having an internship experience or not, I think we don't really have a formula for that. We do like people that have had experience because at least they know what they're getting into. But I say apply the first time if you know this is what you want to do, because some of our best chiefs, including Wilson, who's at Kaiser, the TMJ guru, was straight out of dental school, and his co-resident did cosmetics and still does cosmetics in the Maryland area, and he's excelled. So I don't think you should shy away from it if this is what you really want to do. But the other thing is taking personal ownership of your success. Don't point fingers because you didn't get into a program because of the school or because of the curriculum. You have to want it so much that you're willing to do everything it takes. So take that CBCE over, do that internship and do well, and apply again if you don't get in the first time.
Now, you say grit over grades, but I know one of the things that looms over many candidates is that exam. And I've talked to residents, we've talked about it as far as some tips as to, when's the best time to take it. I would love for you to get your feedback on that, in addition to score range, right? Because depending on the program, you will maybe get an interview or not get an interview, depending just on that score. Yeah. So could you shed some light with regards to that as well?
This is such a difficult thing for me.
Well, we asked the hard questions here, so
Yes. So I always miss your first question when you had that second question. But so to address that, well, first of all, the tips for with the CBCE, I think the most important thing is taking it as early as possible in your school training, because that basic science will help you do better if you take it early on. With that being said, I know people that have taken it closer to the end of their of their dental school, and they've done well. So from what I remember, our last group of applicants, most of our applicants had what was considered passing. And if I'm not mistaken for the CBCE, it's like 192 or somewhere around 195. But we had probably maybe 7% of our applicants were below that because of other things in their portfolio, including if we were recommended them by an alumni. I put a lot of weight on alumni that have groomed potential residents during their dental schools, because I feel like that relationship helps give them accountability, so they can't come to the program and think, oh, it's going to be easy, because they're going to have that oral surgeon that they knew from back home saying, look, dude, get it together, or look, girl, get it together. And so I think that relationship helps them perform better. And most of our alumni recommendations excelled in their training, even when they've struggled initially. But that test, I think the other thing about that CBCE is, and I think this is a good skill for anybody, because the board's going to be the same thing, is practicing taking the exam. Because even if you don't know or haven't covered that material, if you practice taking that exam and then looking at the answers, you will become accustomed, as one of my residents said to me, you'll be accustomed to your opponent. So think of it as a sparring match. If you don't spar with that opponent constantly, you won't know their weaknesses and their strengths. And so that same thing happens when you prepare for any written exam, any multiple choice exam, is to go over as many of those questions as possible. And then the other thing is to talk to other people, not just the people that are in your circle, but talk to people at other institutions, talk to people that have already finished the program, because then you'll get tidbits that you wouldn't get otherwise. One of the reasons why, when I was SNDA president at Michigan many years ago, that I opened up our membership so that we were ensuring that we had diversity within that organization. organization was because we wanted people, first of all, we wanted people that cared about the causes, cared about the things that underrepresented minorities dealt with, but also if they have that desire to want to be a part of it, then they can share knowledge that maybe we would not get if we were isolated. Right. And so I think that's important to not be isolated. I think that's one of the weaknesses I had as a resident, that I was very isolated. And even though I knew some people from UCLA, I didn't feel comfortable asking them questions and things like that. And our residents now come out and they have intimate relationships with UCLA residents where they're like friends for life. And that gives you, that smaller program or that smaller institution that you may be training, that you gain knowledge from other institutions and other people that, their attendings, maybe board examiners or what have you, to give you some more insight, just like what I was able to get from our previous program director, my predecessor, who was also a board examiner, just really learning how to learn.
Yeah. Yeah. So those are some good tips for the exam. Range of scores. I think you mentioned a 190 something. Is that a new?
Yes. And that's why I'm not as familiar, because we used to scores where it was, I think our range at that time was about the lowest score that we were accepting was like 50 or 48, but ooh, they changed it, I think, to match what medicine, with how they interpret it. So they take the raw score and they have a passing score that would be equivalent to whatever it is for medical school, which is perfect for 6-year programs, because then they know you can.
Right. So what you're saying is that there was a recent change in the CBSE scoring, so that it's not necessarily a 2-digit score. Now it's a 3-digit score.
Yeah.
Oh, you guys learned it here. Wait a minute. You learned it here. I did not know that.
Yeah. When I got the scores last year, I was like, what is this?
Yeah. Like, who's got 100 and something? Oh my God, let's take them right now.
Right. Exactly. Wow. So still try to be close to passing, but right. I still say don't not apply.
Right.
Because each of our faculty members, part-time, volunteer, whoever wants to review the files, all review the files. And we all have a say-so in who actually interviews, whether we sit down together as a group and defend the people that we want to interview. And our program director is very gracious in he doesn't have a lot of hard no's. So even people that graduated from our GPR program that may not have done as well on their CBCE, he doesn't, say, well, no, because they didn't do well. If we know that candidate can be a good resident, then fight for it. And so in some of those times, those people either match there or match somewhere else. So I think that's right. And a tip as far as applicants are concerned, do not limit the programs you apply to.
Oh, this is good. So we're going right into the tips, y'all. Here we go. That's okay. That's good. That's good. Just so people are listening, because they probably writing notes. So we're going right into the tips. This is the part that you were supposed to stay all the way through to. Yes. Tips. So go ahead, Doc.
So one of my biggest tips is apply to a wide range of programs. I had people that I was mentoring that limited their applications to historically Black programs, and limiting yourself does not give you a fair opportunity to get into a program, because like our program is very diverse. They call us the United Nations because we're not at this point technically historically Black program, because we're at Harbor, and but our program, we always have underrepresented minorities within our program. But there are a lot of programs that want to be more diverse. And so it's okay to be the first Hispanic female at a program that has never had a Hispanic female. And same thing for African-American male. If they've never had an African-American male, if you are the first, that's a good thing, because then that makes us permeate all areas. That's one of the reasons why one of my residents who recently graduated, that is at Mass General, I encouraged her, yes, we would love to have you back at Harbor. However, if you can get a position at Penn, then you'll be the first African American faculty at Penn. And so that would give us a lot more options and give us a lot more representation within our specialty and in our educational system.
Yeah,
So
don't limit the number of programs. Do not limit.
Obviously that means you got to save some money because I know it's expensive, but
hey, living on the planet is expensive.
Yes, this is true.
What other tips for candidates that are applying now, or that are as early as first year? Because there's some D1s that already know or surgery,
Yeah.
surgery, and then there's some D3s and D4s that are probably have thought about oral surgery, but maybe just haven't jumped into it as of right now. So, what are some tips for them as well?
Okay. So I think knowing yourself is very important so that you can be critical about how you perform at whatever aspect of your education. So what I mean by that is that if you are already interviewing, for instance, or if you started talking to faculty members that could do mock interviews, or even graduate residents that are in the training program or recent grads, have you practiced interviews, which is one of my tips with that, is you have to still evaluate where you might be weak and be okay with understanding that, because if you don't, then you won't improve for your next opportunity. And I've had some interviewees that, again, they didn't take ownership. And so it was a turnoff even giving them opportunity to be an intern, because, everything was everyone else's fault. And yes, there are things that happen that are external, but the fact is you have full control of how you how successful you are. If you don't believe in that, then you will never succeed. And I know, because I was that victim mentality that, this person did that and that's why this. No, you have to believe in yourself above all else. Let's see, other tips. Take your classes seriously during dental school, especially for you that are in your first or second year or just getting in. Work hard to do well in all of your classes, because those small credit classes that have that you may not think are important because it's not gross anatomy, all of that adds up. Now, a lot of programs now our dental schools are pass fail.
Oh my goodness, yeah.
So in those cases, I think that the thing that you can do that will help is being involved in other extracurricular activities, whether it's being a research assistant in a lab, so that when you interview for a program, which if you apply to enough of them, you will get an interview, that you sound articulate, you know what you're talking about. If you can do something that's focused on oral surgery, that's phenomenal. But even if not, you can focus on pain, because that's also important in oral surgery, or implants, or perio surgery. Any of those things can help enhance your application if you don't have if you have pass fail. But then that goes back to doing really well on that CBCE. I would say shoot for passing. If you're close to passing and you did not pass, it is still not a bad mark, because some programs do not prioritize a CBCE, but
Right.
we all have to have some way of assessing your academic performance. If you are in a school that gives grades, then make sure your grades are good, because we've had people that their CBCE was not good, but the grades were great. And for me and most academicians that are in, in these safety net type of hospitals, are looking at performance overall.
Right.
And one score is not as good as your overall performance, because that shows consistency.
Yeah, and I think also at some point when candidates get that interview, they will, be prepared to have to address, your scores, right? Just like you have to address other questions and other areas about your candidacy, like why oral surgery, why do you want to come to this program, and all of that. But I think this is an area that a lot of people get hung up on as far as their scores, pass, fail. Yes, there's still this holistic approach, but there also is reality, which is a numeric approach as well, to try to give a better assessment as to whether you as a candidate are going to be a good fit for that particular program. So some really great tips.
Yeah, I was going to piggyback on that. That is one of the questions that most residents don't take responsibility. So, and that to us is a red flag. So if you're being asked to explain, a mark on your application, which everybody has something, and so, but if you don't look at it objectively and see how can you learn from that experience. We had one of our stellar residents recently. When he applied, he had something that happened to him in college, and he talked about first of all, what mistakes he made, even though he technically was not at fault for what happened. But then he talked about what he learned from it and how he is glad that he went through that experience. Now, that doesn't mean you're glad that you made mistakes that you make, but you can try to turn it around or pivot that to be a strength in the future. And that shows maturity. And which is also one of those intangible characteristics that we look for, someone that can handle adversity and understand how to win, as well as how to be a graceful loser and learn how to win eventually.
Yeah, you guys heard it. You guys heard it. So question of the day, guys, what did you learn today that you did not know, not only about this particular oral surgery program, but also about your candidacy, your desire to become an oral surgeon? Was it something in the tips? Was it something about what the ideal candidate is? Was it something about the actual curriculum that you're looking for? Or was it really like your why you want to become an oral surgeon? Put those comments down below and let us know what you like best about so far about today's episode, and what you learned that maybe you were not thinking about previously. Put those comments down below. So Doc, we have time for maybe about one more question, which is, everyone has heard a lot of good stuff from you today, especially those that have not met you for the first time or haven't met you years ago when we did a couple of videos about oral surgery. What's the best way for candidates or individuals that are interested in oral surgery, whether it's your program or just the profession or the specialty itself? What's the best way for people to get in contact with you if they have questions or need some help?
Okay, so I have a couple email addresses because I'm always doing something somewhere. My primary email is CCC, D as in dog, D as in dog, S as in Sam, P as in Paul, H as in Harry, D as in dog, @yahoo.com. I also have my work email, which is ccalhoun@dhs.lacounty.gov. And then my research address, which is probably the most consistent, is calonya.calhoun@lundquist.org. calonya.calhoun@lundquist.org.
Good.
And
you got
put on the subject mentee.
And put in the subject what?
Mentee.
Mentee. Guys, look at those right up top there. Check those out. It's up there. You can check out those ways to get in contact with her. Well, I will tell you, Dr. Calhoun, it's been a pleasure. It's been very helpful, especially for not only me. I learned something new today with the new scores, and also learned a little bit more about your program, about the extensive and breadth of the educational experiences that makes you guys one of the leaders in oral surgery training for dentists. So thank you so much, guys. Check out the rest of these videos here. Hopefully they are helpful as well. And that's our time. We'll see you later. Love, peace, and smiles. See ya.